Do you go to pelvic floor physical therapy and feel like it's a complete waste of time? Do you walk out and not feel that much better? Have you committed to a full plan of care and then realized things haven't even improved a little bit? Or maybe they did for a short amount of time and then they came back? Well, you're not alone. We're going to talk about in this video exactly what to expect and how to find a pelvic expert physical therapist in your area. Not all pelvic floor physical therapists are created equal, and there's a big disparity in training, in execution, in mentorship. And so a lot of patients find themselves, going through the wheelhouse of trying to find someone that works for them, and they give up. This week alone, I saw 5 patients that didn't get better with pelvic floor physical therapy, but yet are giving it another shot and are willing to come try the body motion protocols and find something that works for them. And they all had relief after the very first session. So it's heartbreaking. It's also very sad to know that some people's symptoms don't get validated. It's also very sad about what's out there. A lot of people are like, yeah, I had pelvic floor physical therapy. And I say, oh, okay, so you've had an internal exam before. And people say, no, I haven't. And I'm like, okay, so you haven't had pelvic floor physical therapy. Pelvic floor physical therapy includes an intravaginal exam or an intrarectal exam. Most often than not, people look at the pelvic floor the first time through the intravaginal canal with a gloved finger, and that is how we get assessment of what is going on in this group of muscles. If you had something wrong with your shoulder, you would find a shoulder expert, someone who is going to get to know your shoulder, know how it's functioning, and work on the tissue to restore normal tissue. When we have injuries, tissue tends to get dysfunctional. We get scar tissue, we get adhesions, knots in the muscle, and then the joint doesn't move properly. Well, when we have the same thing happen in the pelvic floor, we get knots, we get scar tissue, we get adhesions, then the pelvic floor doesn't work properly. And that gives us either incontinence, so peeing our pants, difficulty with bowel movements, either constipation, diarrhea, hemorrhoids, anal fissures, incomplete emptying, so you might not feel like you ever get a clean wipe. It can give you low back pain, it can give you hip pain, it can give you pain with intercourse, it can make intercourse feel weird or like your partner's hitting something, it can make it feel like you can't orgasm, or orgasm can be incredibly painful. It can also present as lower abdominal cramping. That is a whole range of things that the pelvic floor affects, but because it is internal, a lot of people don't treat it the right way. And there's not a lot of education in how to treat pelvic floor. So even though the pelvic floor physical therapy has gotten extremely popular, there's a big disparity on how it's executed. And unfortunately, that just has to do with there's not a lot out there as far as people getting enough mentorship. Once you graduate from school, a lot of people just want to go and start working, rightfully so. There's a lot of loans, and they just don't have the time or money to get the proper education in order to carry out effective pelvic floor physical therapy. There's also a lot of politics involved. Sometimes people work in these busy outpatient centers and their bosses want to have a pelvic floor physical therapist, so they might maybe twist someone's arm to go take a weekend course in pelvic floor physical therapy. To become a true expert, it really takes mentoring from an expert and really getting to know exactly the treatments that you're carrying out and how effective they are. And am I doing the same thing that the expert is doing? And so I'm saying this from a pelvic floor, perspective, but a lot of patients don't realize what pelvic floor should be or entailed because all they know is their one experience. So if pelvic floor physical therapy hasn't worked for you, I truly recommend searching for somebody else. So let's talk about what that search should look like. When you are searching for a pelvic floor physical therapist in your area, this can be a little scary. You might type it into Google and you might find a local hospital system, has a program. You might have a friend who sees somebody. But all in all, you want a therapist who is going to treat the pelvic floor intravaginally and not just prescribe Kegels. So a lot of times what we're getting is people are getting their pelvic floors evaluated. And so what that can look like, pretend this is a vagina here. You insert the finger and you're just like, okay, squeeze my finger. They squeeze it and they relax it. And they usually say, oh, okay, you're good. Let's start doing some Kegels and some training. Well, that's not how this works, okay? The pelvic floor is actually 3 layers of very intricate fascia, of muscles, of nerves, of arteries, of veins, and there's a lot going on here, of sphincters. And if we don't assess all of that in detail, we might really miss what is causing maybe someone's bladder pain, or what is causing someone's discomfort when they're doing deep thrusting intercourse. All right. So all of this really matters as finding the culprit and the root cause of the issue. A lot of these people that have pelvic floor issues also have maybe some low back pain or some hip pain or knee pain. And so it's really important that you find someone for the actual root cause, which is oftentimes the driver of those dysfunctions, the pelvic floor. And so how to find somebody? We want someone that does internal manual pelvic floor physical therapy. You don't want someone that always does biofeedback. You don't want someone that always does Kegels. Can those be a part of the treatment? Sure, sometimes, occasionally. Should that be the go-to? Absolutely no. If that is your treatment plan, it's time to find somebody new. All right. So there's a lot of intricacies in finding a great expert pelvic floor physical therapist. There is a website called the Global Pelvic Health Alliance, and that is a good starting ground to start to interview and find pelvic floor physical therapists in your area. And so I will drop the website in the show notes as well, and that can help you start to at least interview people to get to know how the treatment approaches are. When you're getting treated for pelvic floor, so the intravaginal manual therapy is very important. And if you the other things that we discuss and we treat and we assess are the hips, the low back, and also the abdominal wall, along with the entire body. Like someone looking at all your posture and how you walk, how the forces are transmitted from your foot up into your pelvis is really important, because we want the pelvic floor to be super dynamic and dynamic enough to absorb those forces. If your pelvic floor is more cement-like and you don't have good opening, then it's harder for you to absorb those forces. So when finding a pelvic expert physical therapist, you want someone who's in line with that level of thinking, that yes, I need the range of motion of my pelvic floor, and that doesn't mean I need to work on the contraction, because more often than not, people can get the contraction or they can get a semi-contraction, which might be enough for them and for their function, but what they can't get is that relaxation. And so it's really important that you work with someone that can really help identify the true dysfunction in the pelvic floor and isn't gonna do just a 5-minute assessment intravaginally. The shortest you can really get these intravaginal assessments are maybe 10 minutes each side. If you're doing the right side, then the left side. A lot of times it's a comprehensive mapping of the tissue is gonna take 20 minutes each side. And that is going to be the full assessment. And so you don't want someone that just like sticks a finger in. I don't feel anything. There's no spasms. You're good. They're not assessing all the tissue. All right. They're not assessing the nerves. They're not assessing the sphincters. They're not assessing, all 3 layers of the muscles with intention. All right. And if you know your anatomy, you know how to assess this with intention. Especially if you've been doing it for a while and you're an expert, you know how to truly, feel these tissues in a way that you know what is typically tight. When that happens, people get better, and you get to the root cause of a lot of these issues. If you find yourself that you are one of those people that just never had that kind of assessment, that's most likely what you need. And I hope that you don't give up hope and continue the journey of finding a pelvic expert physical therapist who can help get to the true root cause of your issues. Again, you can check out that directory, or you can contact us and we can help you. We also work with people across the United States who fly in for what is called intensives, and they come to us for pelvic floor physical therapy for either, a week or 2, and they'll do sometimes only even 3 days, but they'll do intensive 3 to 4 hour treatments during those days. So that can be an extremely beneficial treatment if you are out of state and you don't have someone in your area who treats pelvic floor in which the ways that we've discussed today. Essentially, if you're getting pelvic floor therapy and they're not doing internal therapy and they're not doing internal work, or they're having you do a bunch of Kegels or work with biofeedback machines and work with stimulators to cause contraction, most likely we're not getting to the root cause of what's going on. So when we get to the root cause of what's going on, the pelvic floor just works naturally. And you don't have to work on contracting it 700 times a day in order to make it strong. Like, no, the glutes, you get them firing and you get them working, they're protective for the pelvic floor. They help keep the pelvic floor in a good tone. You get your breath patterns in your visceral motility, so how the organs move in your belly, moving correctly, then your pelvic floor can be at its normal resting length without a lot of stress from the organs above, and managed your pressure well with your breath patterns and your movement. That's how you have a strong pelvic floor. We don't generate a strong pelvic floor by doing repetition after repetition of Kegels. So that's a pretty archaic method of healing, and I hope that this has helped open your eyes into what true Pelvic Expert physical therapy is all about, and I hope you can find one in your area, and we are so happy to help you. If you want to fly out to the Seattle area, you can fly into Seattle International Airport, or you can fly into Payne Field, Everett Field Airport, and come see us at our Edmonds location, and we would love to help you. So drop a line in the comments below if you have had pelvic floor physical therapy, and then if you don't mind sharing if it was effective or not effective. I would love to know. Please like and subscribe and share this with all your friends who need to find a pelvic floor physical therapist in their area, or find a really good pelvic floor physical therapist in their area. Or please reach out and we'll be in touch with you. All right, take care. Dr. Allison here, and I hope that you and your family are well supported with amazing Pelvic Expert physical therapists in your area.